91 personnel of Ghana's premier hospital, the Korle-bu Teaching Hospital, have so far tested positive for COVID-19. The facility has been forced to suspend non-emergency surgery and urgent cases at least for the next 2 weeks. The decision to suspend non-emergency surgical cases, according to the hospital, was necessitated by the fact that some staff have been infected with COVID-19. The measure is intended to protect the remaining hospital staff and clients who are on admission at the facility.
This is Ghana's premier hospital, and coronavirus is wreaking havoc here. As at the end of June this year, about 71 health professionals had tested positive for coronavirus. Today, the figure has changed. 91 health professionals here had tested positive for coronavirus. The development has forced the facility to suspend emergency and urgent cases.
The hospital management decided to suspend non-emergency and urgent cases for the next 2 weeks. There are reasons for this. One is to protect our clients and patients, and then two, to also protect the rest of staff who are still at post and then providing care to patients.
How many of your staff have been infected with COVID-19?
As of last week, we have about 91 staff members who are infected with the disease, and then we are still working, but within the circumstances, we thought it wise to scale back so that we will not expose our patients, and they are the reason for which we work here.
Did you say 91?
Yeah, 91, yes.
And this latest one, which has informed the decision to suspend non-emergency services, how many are we looking at?
It's not the latest. We are looking at the cumulative figures that we have received, and that is why we are taking this decision. We have staff who are critical to the care that we provide, particularly the surgical interventions that we do in the hospital, and if a good number of them are exposed, it is only fair and proper for us to scale back and use those who are not affected to still provide the care to the dire emergencies. So we are calling on sister hospitals not to refer the non-emergency and urgent cases. They should try and then refer to other appropriately equipped facilities within the metropolis to handle that whilst we observe this period of suspension for the next 2 weeks.
So over the period, that is by end of June, you had 91 of your workers infected with the virus, correct?
Yes, as at last week.
How many have been asked to go into quarantine? I'm sure you did contact tracing. So out of this 91, we know the 91 for sure they are on isolation. How many have been asked to go on quarantine?
When you are affected, out of this 91, remember some of them have been treated and discharged and they are back to work. And then if you want the exact numbers, I'll have to check on that and then get back to you.
So how many of the units have been affected in this whole development of COVID outbreak here?
No, for what we are saying now, the surgical interventions, all of them will be affected in that. So you have the ENT, you have the general surgery, the main surgical block will be affected, ENT, pediatric surgery, accident and emergency, obstetrics will also be affected. So for all of these areas, we are going to see to the dire emergencies for the next 2 weeks. So we are asking for this so that we can reorganize ourselves and then resume normal operations without putting our patients in harm's way.